Do you know what your practice's strengths and weaknesses are? Do you know what families like or dislike about your practice? Sometimes gaining perspective from people who aren't involved in your daily operations can provide valuable insight into the service and care you provide. And using that insight to make improvements not only enhances care delivery, it can also make your practice a sought-after provider of quality care. Many primary care practices have formed family advisory groups to learn what aspects of the practice work for families, what barriers to quality care may exist, and what can be done to make patient visits a productive experience. A family advisory group is a gathering of parents and caregivers who have agreed to work with staff and clinicians to enhance the care and services that the practice provides. It also includes some members of the practice team who serve as facilitators of the group. Establishing a family advisory group is a very useful strategy that can strengthen a patient and family-centered medical home. A medical home uses a team-based approach to care. It's led by pediatricians or family physicians and will likely include nurses, nurse practitioners, physician assistants, medical assistants, office staff, parents, and caregivers, among others. A pediatric medical home works with families to enhance their child's well-being, including physical and mental health. A family advisory group is an example of one way to embrace true partnership between parents, caregivers, and a practice team. Parents and caregivers are respected as the core members of the advisory group. Their opinions are valued as much as those of the practice staff who are facilitating the group. These groups give parents and caregivers an opportunity to share their experiences and offer their perspective on what it's like to visit your office. They can voice concerns, make recommendations, and offer valuable insight on how best to improve the practice from the family point of view. They can also share positive experiences and express their support for the practice's commitment to providing quality care to the patients and families it serves. This can help ensure that children receive the best possible care and experience optimal outcomes. It also helps parents to feel empowered and more in control of their child's health care. Family advisory groups usually meet on a regular basis to share experiences, identify specific issues, and discuss projects that can make the practice more patient and family-centered. For example, advisory groups can provide input on clinic operations, the facilities, any issues patients and families have with services, as well as communication between the practice and the families. Members of a family advisory group can also offer valuable input concerning a young patient's transition to adult medical care, or raise awareness among the practice team about peer support resources for families whose children share the same chronic conditions. Some groups have even created educational materials that are displayed in the practice or on the practice website. Other groups have helped with the development of useful tools, such as a pre-visit questionnaire, or suggested replacing an automated phone system with a live person and posting signage in the waiting room to protect sick children. Family advisory groups can help improve the relationship between the pediatric care team and families by creating open communication. They also serve as a forum for family leaders in the practice to learn more about how they can contribute to the experience other families and the practice care teams may have. Families can also be a great asset to other families in the practice because of their practical knowledge of local services, resources, and key contacts in the community for health and other information. In these groups, families learn about practice management, and the practice learns about family perspectives. In other words, both sides benefit from the information shared during meetings. If you're considering starting a family advisory group, the first step is to gain support from others in your practice, and then be an advocate for the plan. Discuss the potential benefits and risks to the practice, and decide how you want the group to operate. Then, identify a member of the practice team to take the lead on establishing the group. This person should also help to facilitate meetings or other work that results from the group's discussions. Next, establish criteria for selecting parents to participate. For example, you'll want to look for parents who've been with the practice for at least 1 year and who feel comfortable being vocal without being confrontational. You may also want to consider parents who are proactive in their child's care, have suggested changes in the past, or those who expressed an interest in improving the quality of care delivered in the practice. You'll want to ensure that group membership reflects your patient population, including cultural, ethnic, and socioeconomic diversity. You might even consider inviting an adolescent to participate. When recruiting members, you should provide a brief outline of the group's purpose and what will be expected from members in terms of a time commitment and responsibilities. As the group begins, you may want to hold meetings as often as 2 times a month. Over time, you can decrease this frequency to once a month or every other month. Only your practice can determine what frequency of meetings is appropriate and meaningful. Next, set a time limit for the meeting, such as 60 to 90 minutes. This is usually adequate in the beginning and may decrease over time. Meetings should be held either before or after patient hours at a time that's convenient for families, and an agenda should be provided in advance. Meetings can be held face-to-face, as a conference call, or as a webinar. Some practices pay stipends to parents, offer childcare reimbursement for the meeting time, or budget for meeting refreshments. At the initial meeting, the entire group should work together to develop clear goals and expectations. It may take more than 1 meeting to finish the development of the goals, since time will be needed for the group members to get to know each other. Remember, though, that all members have equal standing. Designate a member to take notes and distribute them after each meeting. You might even consider sharing the meeting notes with others in your practice. If you decide to make any changes in your practice as a result of the recommendations, they can be done incrementally. You shouldn't feel like you have to do them all at once. It may seem like a lot of work to form a family advisory group and respond to its recommendations or act on its suggestions, but in the end, it is a win-win in terms of patient and family satisfaction, improved care quality, and your practice's efficiency. For additional information, access the resources and tools available from the National Center for Medical Home Implementation. National Center staff is available to support you and your practice in working to ensure that every child and youth, including those with special health care needs, has access to a medical home.